Welcome, my name is Peter Strong. I'm a professional psychotherapist and I offer Skype Therapy. Skype counseling therapy is a very effective way of working with difficult emotions without using medications, but rather learning ways of working with your emotions using mindfulness therapy, which is what I teach online through Skype. Medications may have some value in some cases, but it's important to realize that they only treat symptoms. They do not change the underlying cause of your anxiety or depression. That underlying cause is basically psychological in nature for most people, for most of the time. It is a habit. It is a form of reactive thinking and emotional reactivity and behavioral reactivity that all feed the particular emotional formation of anxiety or depression or OCD or addiction. These are habits. Habits can be changed, and when you learn the mindfulness techniques that I teach, you will be able to change your anxiety and depression. You'll be able to break free from these habits. The first thing to understand is that all habits operate essentially unconsciously, out of awareness, on autopilot. This is the biggest problem, that we have to overcome straight away. We have to develop a much more conscious awareness around our emotional reactivity. We have to bring consciousness to our anxiety or depression instead of running away from it or trying to find a distraction from it, or through medications, which is really just another form of avoidance. So bringing conscious awareness to our habits is the first step in changing those habits. And that we do in mindfulness therapy by actually meditating on our emotions and on our intrusive thoughts and on our emotional trauma, whatever it might be. We learn to meditate on the mind, on these emotional habits. This means that we deliberately choose to bring the painful emotion or the intrusive thoughts into the mind, but consciously, under our direction, rather than have them just show up unconsciously due to the habitual reactivity. So this is the difference. Bringing them in consciously puts us in a place of power in relationship to those emotional habits. Then we can begin to cultivate this conscious relationship, and in so doing we gain more and more freedom. We can essentially sit with the anxiety or depression and not be controlled by it. So this is a training process. We are choosing to train with our emotions so that we gain more and more freedom. Even if they are there, even if anxiety or depression is still triggered, we are no longer controlled by our emotions. That's the first goal of mindfulness therapy and mindfulness meditation, to gain freedom. The second goal of mindfulness therapy is to heal those emotions. So here we understand that anxiety and depression are simply emotional structures that have become stuck, that are not able to resolve themselves by themselves. They simply operate without going in a direction of healing. They simply reinforce themselves. They sustain themselves through cycles of positive reinforcement, which is characteristic of any habit. The habit simply reinforces itself. So the process that we employ in mindfulness therapy is learning how to change the habit and how to actually bring about resolution, how to train the emotion to resolve itself. This often involves looking at the imagery of the emotion, the so-called structural theory of emotions that I teach as part of the mindfulness therapy approach, recognizes that emotions are based around imagery, and changing this imagery is a very important step in healing any emotion. You have to change that imagery. You have to help the anxiety imagery or the depression imagery change. That is how it heals, and that is how it resolves itself, so it no longer feeds those habits. If you'd like to learn more about Skype Therapy, please go to my website and read more about the online therapy approach. Skype Therapy is very popular now. Skype allows you to see each other, and this makes communication much more effective than in some of the older styles of online therapy. And really, there's no difference between therapy via Skype and seeing a therapist in person. So there are a lot of advantages that we should think about as well. And one of them is just making psychotherapy more available. It's much easier to access on the internet than it is in person. That's one advantage. The second one is that people are wanting to learn how to manage their emotions themselves rather than relying on medications or some treatment protocol. They want to gain control. And so Skype therapy, as I teach it, really focuses on giving you the tools to work with your anxiety or depression or addiction. It teaches you how to train your emotions to resolve themselves. So that's one factor that makes Skype therapy very attractive to many people. Other factors, of course, revolve around the convenience of online therapy. It's much more convenient for you. You don't have to leave home. You can conduct your sessions in the comfort of your own surroundings, and that's very attractive for many people. It's also very necessary for people who are suffering from anxiety disorders. If you are suffering from agoraphobia, then it's very difficult to leave home. So therapy via Skype for agoraphobia is a very attractive option. Other people live in rural areas where they do not have access to local therapists. Skype therapy is also good if you're living abroad or if you're traveling. You can have Skype therapy sessions wherever you are, as long as you have access to the internet. So I see a lot of people abroad. I also see people who are traveling a great deal and want to continue some form of psychotherapy during their trips. So that's another advantage of Skype therapy. So if you're interested in Skype therapy and you'd like to schedule some therapy sessions with me, then please reach out to me by email and let's schedule a session. The mindfulness therapy approach that I teach by Skype is immensely effective, and you should and you can expect to see significant changes after the first 2 or 3 sessions. Once you start applying the techniques that I will teach you in the first couple of sessions. So it's a very fast way of achieving quite substantial results. So that's another thing that I like. It's not like classical talk therapy that tends to be very long-winded and doesn't really give you tools for resolving your emotional suffering. In Skype therapy, we move very fast. We train in a very focused way using mindfulness-based methods. So if this interests you, please contact me by email and I'll be happy to answer any questions you may have. Let's schedule a trial Skype therapy session so you can see for yourself whether this approach is right for you. It certainly is for the vast majority of people who are struggling with anxiety or depression or addictions. So please contact me if you'd like to schedule Skype therapy. Thank you.